Okay, well, time for another video. So I have been kind of modifying how I talk to people who have chemical dependency disorders, their families, the community, other healthcare professionals about chemical dependency for like the last 15 years or so. And I keep trying to explain it in a way that is the most helpful, I guess, for lack of a better term. And so there's the Diagnostic and Statistical Manual, this DSM book that basically breaks down mental health diagnoses into their necessary criteria and that kind of stuff. And of the DSM criteria that are listed for a substance use disorder, the one that I find most helpful, and the way that I typically just kind of, as briefly as I can, describe a chemical dependency disorder, is this: a person will continue to use a substance despite knowing that it has negative consequences. And that, I think, is the fundamental definition of the disorder. But I think that's important to add on a little more nuance. So let's expand that out, okay, into a new, more useful definition of a chemical dependency disorder. So I'm going to say this: a chemical dependency disorder is a brain disease where someone will continue to use a substance despite knowing that it has negative consequences. Additionally, in the same way that someone might have a brain disease where they hear voices, called schizophrenia, where they cannot turn it off, a person with a substance use disorder will think about using the chemical and they cannot turn it off. A person with schizophrenia doesn't wake up and say, well, I'm going to hear voices today, or no, I don't have time to hear voices today, I'm not going to hear voices today. They're going to hear voices whether they like it or not. And they can want to not hear voices as hard as they can, but without treatment, they're going to hear voices. And somebody with chemical dependency doesn't wake up and say, well, I want to think about using the substance today, or I don't want, they have no control over it. They're going to think about using that substance whether they like it or not, especially early in their recovery. And there's nothing they can do to shut it off. And so if they believe that they should be able to just wake up one day and just stop thinking about using the substance, and they can't, they're going to feel like they're a failure, because they don't understand that this is a brain disease, that whether they like it or not, they're going to think about using that substance. And also their family and their community are going to be like, well, just stop using. It's not that simple. Their brain is thinking about using all the time. And sometimes they'll have the motivation to overcome those thoughts, and sometimes they won't. And when they relapse, don't everybody panic. This is a brain disease and it's difficult, but with treatment, you can not turn off the voices, but you can turn them down. And that is the focus of treatment, is progress over time, getting it under control, turning down that desire to use, that constant voice in your head that says, man, a beer right now, or some whiskey right now, or some heroin right now, or some fentanyl or whatever, methamphetamine, whatever it is that you're using, that you're thinking about using it all the time. And this kind of plays into my other video about the three-walled prison. And so for those of you who are struggling with a chemical dependency disorder, or have a family member with a or someone that you care of, or that are treating somebody with a chemical dependency disorder, it is important to understand this brain disease concept, that it's a nightmare. I'll have people who are actually making quite a bit of progress in their recovery, and they'll dream about using the chemical at night, about using whatever it is that they're usually using. And it's very disturbing for them, because they feel like they want their brain to let this go, that they are committed to moving on to something else, but their brain will not stop thinking about the substance because it's a brain disease. And so that's kind of how I help people when they call me up and they're panicked and they're like, don't give up on me, but I've relapsed again. I'm like, don't give up on yourself. because you seem to think that you should just be able to turn it off, and you're frustrated and you're disappointed and you're, whatever, because you feel like you failed because you have not been able to turn it off. And so I tell them, hey, this is a chronic relapsing disease. This is a brain disease. You're going to think about using this chemical whether you like it or not. So when you do relapse, and you probably will, don't panic. Don't everybody panic. Keep that relapse short. Get back in to call me or to talk to me or whatever, to see me. Let's get you back on track. Let's get through withdrawal. Let's get you back on some sort of medicine to not turn off that constant thinking about the chemical, but to turn it down. And whatever chemical you're using, methamphetamines, alcohol, benzodiazepines, opioids, whatever, there are medicines that are available to help reduce that desire, the craving, to reduce the number of days that you use per month, and to make progress in recovery. So remember, this is a brain disease. You're going to think about using that chemical whether you like it or not. We can turn it down, but the expectation that we can just instantaneously turn it off, that's just not going to happen. But number 2, watch my video, The 3-Walled Prison of Chemical Dependency. Let's create a daily framework that helps you understand what you should be doing every day to make progress in recovery. And when you do relapse, because you probably will, don't everybody panic. Keep it short. Get back into recovery. Give me a call, what have you. Don't give up on yourself. This is a tough problem, and it takes a while to get it under control. Good luck, and if you are struggling, give somebody a call and keep that relapse short. Okay, good luck. Thanks.